Global health authorities and international maritime agencies are currently responding to a significant multi-country cluster of hantavirus infections, an outbreak that has drawn intense scrutiny due to its atypical setting and the specific strain of the virus involved. According to official reports from the World Health Organization and the Africa Centers for Disease Control and Prevention, as of early May 2026, a total of 8 cases have been identified, including 6 laboratory-confirmed and 2 probable infections. This cluster is uniquely tied to the international cruise vessel MV Hondius, which departed from Ushuaia, Argentina on March 20, 2026, destined for the Canary Islands. The epidemiological timeline reveals that the index case, an adult male passenger, began manifesting symptoms of fever, headache, and gastrointestinal distress as early as April 6 while at sea. His condition deteriorated rapidly into severe respiratory distress, leading to his death on board by April 11. The gravity of the situation escalated as subsequent cases emerged among both passengers and crew, representing 23 different nationalities and triggering a coordinated international contact tracing effort. Public health officials are particularly focused on this event because laboratory sequencing has identified the pathogen as the ANDV virus, or ANDV. While most hantaviruses are strictly zoonotic, meaning they only jump from animals to humans, the Andes virus is the only known strain capable of limited person-to-person transmission. This characteristic significantly alters the risk assessment for closed environments, like cruise ships and medical facilities. The World Health Organization currently assesses the risk to the global population as low, but the risk for those directly connected to the vessel is considered moderate. Hantaviruses generally belong to a family of enveloped RNA viruses carried by specific rodent reservoirs. In the Americas, these viruses typically cause Hantavirus Pulmonary Syndrome, or HPS, a severe and often fatal respiratory disease. The infection is traditionally contracted through the inhalation of aerosolized viral particles from rodent excreta, such as urine, droppings, or saliva. However, the confirmed presence of the Andes virus in this 2026 cluster highlights a more complex transmission dynamic, as the timing of symptom onset among secondary cases closely aligns with the established incubation period for human-to-human spread. Patients in this outbreak have shown a progression from initial febrile illness to acute respiratory distress syndrome and shock, with a current case fatality ratio standing at a concerning 38%. As the investigation continues, health departments in the United Kingdom, South Africa, Switzerland, and the Netherlands remain on high alert, monitoring disembarked passengers and coordinating the repatriation of remains under strict biosafety protocols. The clinical and laboratory response to the current hantavirus cluster has mobilized high-level biocontainment facilities and intensive care units across 3 continents. On May 2, 2026, the first laboratory confirmation of the virus was reported by South African health authorities after a critically ill passenger was medically evacuated from Ascension Island to a specialized ICU in Johannesburg. Diagnostic protocols employed a broad respiratory pathogen panel that initially returned negative results for common viruses, but subsequent polymerase chain reaction, or PCR, testing confirmed the presence of hantavirus. Further metagenomic sequencing conducted by international reference labs definitively identified the Andes virus strain. Currently, 4 patients remain hospitalized in various states of severity, 1 in South Africa, 2 in the Netherlands, and 1 in Zurich, Switzerland. The medical reality in these ICUs involves managing a rapid and violent pathology known as capillary leak syndrome. In this process, the virus targets the endothelial cells lining the blood vessels, particularly in the lungs. This causes the vessels to become abnormally permeable, allowing plasma and red blood cells to flood the alveolar spaces. For the patient, this manifests as a sensation of drowning from within, often accompanied by a non-productive or hemorrhagic cough as the lungs fill with fluid. This state of non-cardiogenic pulmonary edema frequently leads to cardiogenic shock, where the heart becomes unable to pump sufficient blood to vital organs. Laboratory findings for these patients typically show a triad of symptoms: thrombocytopenia, which is a low platelet count, hemoconcentration, indicated by an elevated hematocrit level, and the presence of atypical lymphocytes. Clinicians at the Africa CDC and European health agencies emphasize that there are currently no FDA-approved vaccines or specific antiviral treatments for hantavirus. Management is strictly supportive, involving mechanical ventilation and, in the most extreme cases, extracorporeal membrane oxygenation or ECMO to bypass the failing lungs and heart. The logistical challenge is compounded by the long incubation period of the virus, which can range from 1 to 8 weeks. This window necessitates a rigorous 45-day active monitoring period for all individuals who were on board the MV Hondius. National international health regulations focal points are now working to track 34 passengers who disembarked prior to the official notification. The investigation also looks toward the vessel's origin in Ushuaia to determine if the primary exposure occurred via local rodent populations, such as the long-tailed pygmy rice rat, before the ship's departure, or if the virus was introduced to the ship's environment through other means. Prevention and surveillance remain the primary tools for controlling hantavirus, as the scientific community acknowledges significant limits in our ability to treat the disease once it reaches the pulmonary stage. Public health guidance issued by the CDC and the WHO in light of the 2026 outbreak stresses the importance of environmental hygiene, particularly in areas where rodent activity is suspected. The core directive for both the public and maritime crew is to avoid dry sweeping or vacuuming in potentially contaminated spaces. These actions can kick dormant viral particles into the air, creating the very aerosols that humans breathe in to become infected. Instead, experts recommend a damp mop protocol using a 10% bleach solution or professional-grade disinfectants to wet down surfaces before cleaning, which effectively deactivates the virus's lipid envelope. For those who have been potentially exposed, such as the passengers and crew of the MV Hondius, the current protocol is active symptom monitoring for 45 days, focusing on the emergence of high fever, muscle aches in the large muscle groups, and sudden gastrointestinal issues. Surveillance efforts are also being intensified in the rodent reservoirs of South America and the southwestern United States. Field biologists and public health workers use trapping and testing to monitor the prevalence of the virus in wild populations, providing an early warning system for potential spillover events. Despite these efforts, much remains unknown about the long-term persistence of hantaviruses in various environments and the precise triggers that lead to human-to-human transmission in the Andes strain versus others. While the current cluster is being managed through isolation and international cooperation, it serves as a stark reminder of the speed at which zoonotic diseases can transition into global public health concerns. The lack of a specific antiviral or a widely available vaccine means that early detection and immediate referral to a facility with advanced ICU capabilities remain the only factors that significantly improve survival rates. As the medical community reviews the footage and data coming from the current ICUs in Johannesburg and Zurich, the focus remains on stabilizing the remaining patients and ensuring that no further secondary transmission occurs. Authorities urge travelers to remain vigilant but calm, noting that while the virus is severe, it is not easily caught through casual contact in most everyday settings. This report will be updated as more data from the ongoing metagenomic studies becomes available. For more updates on global health surveillance and reporting, consider subscribing. The clinical escalation of this hantavirus cluster has placed extraordinary pressure on specialized biocontainment units and tertiary care facilities across the affected regions. In the high-intensity environment of the ICU, the primary challenge for medical teams is the management of Hantavirus Pulmonary Syndrome, or HPS, which can progress from mild febrile symptoms to total respiratory collapse within a matter of hours. The bloody cough referenced in recent reports is clinically recognized as hemoptysis, a condition where the patient expectorates blood or blood-stained mucus from the bronchi, larynx, trachea, or lungs. This occurs because the virus does not directly kill the cells it infects. Instead, it triggers an intense immune response that targets the endothelial cells lining the pulmonary capillaries. As the immune system releases a surge of cytokines and interleukins, the blood vessels become hyperpermeable. This leads to the hallmark of the disease, non-cardiogenic pulmonary edema, where the lungs effectively fill with the patient's own plasma. Medical staff operating in these zones must adhere to the most stringent biosafety protocols, often utilizing N95 or P100 respirators and full-body protective suits to mitigate the risk of aerosol transmission, which is a particular concern during invasive procedures like intubation or bronchoscopy. Laboratory diagnostic remain the backbone of the containment strategy. Though the window for detection is narrow, epidemiologists rely on a two-pronged testing approach to confirm cases. The first is the detection of viral RNA via reverse transcription polymerase chain reaction, or RT-PCR, which is most effective during the early prodromal phase when the viral load in the blood is at its peak. The second involves serological testing to identify the presence of specific antibodies, namely hantavirus-specific IgM and IgG. Because hantavirus symptoms, such as high fever, severe muscle aches, and gastrointestinal distress, closely mirror more common illnesses like influenza or malaria, diagnostic delay is a recurring risk. To counter this, the World Health Organization and the Centers for Disease Control and Prevention have streamlined reporting pipelines, ensuring that samples from transit hubs and maritime vessels are prioritized for genomic sequencing. This sequencing is vital for identifying the specific strain of the virus, as different strains carry vastly different mortality rates and transmission risks. For instance, while the sin nombre virus in North America is not known for person-to-person spread, the Andes virus strain identified in the current 2026 cluster requires much more aggressive isolation of close contacts. The logistical and shipping angle of the outbreak has prompted a coordinated response from the International Maritime Organization and national port authorities. Because hantaviruses are inextricably linked to their rodent reservoirs, any environment that facilitates rodent-to-human contact becomes a focal point for surveillance. On board large vessels or within major shipping ports, the management of grain stores, waste disposal, and cargo hold integrity is being audited to prevent the nesting of infected rodents. Surveillance teams are currently conducting environmental sampling in the storage areas and ventilation systems of the MV Hondius and related transit points to determine the point of origin for the viral aerosols. Meanwhile, at the administrative level, health ministries are reconciling verified clinical data against the influx of unverified information circulating online. Official statements emphasize that while the footage emerging from these medical centers depicts the severe reality of the disease, it should be viewed through the lens of established virology rather than sensationalism. The current data indicates that the fatality rate remains high among those who reach the cardiopulmonary stage, but early intervention and the use of advanced life support technologies, such as extracorporeal membrane oxygenation, have shown promise in stabilizing the most critical patients. The focus remains on the golden hour of hantavirus care, identifying the transition from fever to respiratory distress, early enough to begin aggressive supportive therapy before permanent organ damage or fatal shock occurs. The mitigation of the current hantavirus threat relies less on curative medicine and more on the rigorous application of environmental engineering and international surveillance frameworks. Under the One Health Initiative, a collaborative global strategy that recognizes the interconnection between people, animals, and their shared environment, public health agencies are intensifying the monitoring of rodent populations in both rural and urban transport hubs. In South America, where the Andes virus is endemic, field biologists are working alongside epidemiologists to track the population density and viral prevalence in the long-tailed pygmy rice rat. These surveillance efforts are critical because hantavirus outbreaks are often preceded by masting events, where an explosion in natural food sources leads to a surge in the rodent population, subsequently increasing the likelihood of human-rodent encounters. For the international community, particularly those in maritime and logistics sectors, the focus is on the International Health Regulations, or IHR, which mandate that vessels maintain high standards of pest control and sanitation to prevent the cross-border spread of zoonotic pathogens. Practical prevention for the general public remains centered on the concept of aerosol management. The most significant takeaway for individuals living in or traveling through affected regions is the absolute avoidance of dry cleaning methods in areas where rodents may have been present. When rodent excreta are disturbed by sweeping or vacuuming, the viral particles, which are remarkably stable in cool, damp conditions, become airborne and are easily inhaled. To safely decontaminate a suspected area, health officials dictate a specific protocol. First, ventilate the space for at least 30 minutes. Second, wear non-porous gloves and a high-efficiency mask. And third, thoroughly soak the area with a disinfectant consisting of 1 part bleach to 9 parts water. This wetting process is essential to ensure that particles remain heavy and inactive before they are wiped away with paper towels or rags. This method is the primary defense for homeowners, warehouse workers, and shipping personnel alike, as it physically destroys the virus's protective outer layer. Despite the advancement of modern virology, there remains significant limits to our knowledge regarding the hantavirus family. Currently, there is no internationally standardized vaccine for the Andes virus or the sin nombre virus, and experimental treatments, such as the administration of convalescent plasma or antiviral drugs like ribavirin, have shown inconsistent results in clinical trials. Scientific uncertainty also persists regarding the exact duration of immunity in survivors and the specific environmental triggers that allow the virus to persist in nesting materials for weeks at a time. This gap in medical capability places the burden of safety squarely on the shoulders of surveillance and early detection. If a person develops a flu-like illness within several weeks of potential exposure, the ethical and practical imperative is to seek immediate medical attention and clearly disclose their travel or exposure history. As this reporting concludes, the global health community emphasizes the need for a calm, evidence-based response. The emergence of high-resolution footage from intensive care units serves as a sobering reminder of the virus's potency. But it also underscores the critical importance of supporting the frontline workers and researchers who operate in these high-stakes environments. The ethical responsibility of the public and the media is to prevent the stigmatization of travelers or specific geographic regions, focusing instead on the biological reality of the pathogen and the proven methods of containment. By adhering to established sanitation protocols and maintaining international transparency in case reporting, the escalation of this cluster into a broader public health crisis can be averted. Surveillance remains the first line of defense, and informed caution remains the best tool for individual protection. For ongoing coverage of international public health developments and laboratory updates,